reported today in The Verge. Who's afraid of the novel coronavirus? Every horror story begins with a pause, a held breath, when nobody is quite sure what to make of the unfolding situation. When's a good time to panic? My favorites put off answering the question for as long as they can. For the last few days I've been thinking about Severance, the prize-winning 2018 novel by the author Ling Ma, because of its premise: a fungal fever in China spreads across the globe and kills millions, decimating society. It feels ominous that the situation with the novel coronavirus is even passingly similar, even though Ma's book is set in an alternate past. In 2011, just after Occupy Wall Street, people start to get sick in Shenzhen, and it spreads from there across the world. By the time it hits New York, people have begun to abandon the pretense of normalcy, the thing that keeps society running as designed. Ma's best invention, though, is her protagonist Candace Chen, who keeps working her job at a publishing company in Manhattan as her co-workers quit and die and the rest of the world is collapsing. She never panics. In the case of COVID-19, it kind of feels like the opening scenes of a horror movie. The stock market is down, and the quarantine zones are spreading. The virus is burning its way from east to west, taxing infrastructure, governments, and families. Life is starting to change. But we're not living in a work of fiction. The future isn't authored by anyone, and it's absolutely not preordained. As the Centers for Disease Control says, at this time, this virus is not currently spreading in the community in the United States. What's more interesting to me, at least right now, are the people thinking about how the virus will collide with America's social and federal infrastructure. Mostly they're not doctors, they're just people who have worked and lived in America for a while, feeling their way through an upcoming crisis. A person who goes by @GnomeToBarbarian posted a thread about working in food service and what happens when people get sick. The people making your food do not have health insurance. Restaurants almost never offer it. They do not have paid time off. Benefits like that aren't imaginable. They do not have enough people in the schedule to cover an absence. Lean staffing. It's more profitable. pic.twitter.com/z1ntldvh. Which is common sense. If you can't afford to go to a doctor, you don't go to a doctor. It really is that simple. Others have been reacting quite a bit differently, mostly depending on their net worth. Over on Instagram, Gwyneth Paltrow recently posted a picture of herself wearing a $70 ventilator mask. As Jezebel observed, Paltrow isn't wearing a mask out of deep concern for public health, she's posting because she's beginning to panic. And she's not the only one. The government, on the other hand, seems to thin for more on this story. Visit the news article link.